Welcome to the ASCO Guidelines episode of the ASCO University Weekly podcast. My name is Saro Armenian, and I'm an associate professor in the Department of Population Sciences at the City of Hope Comprehensive Cancer Center. Today we feature an ASCO guideline, Prevention and Monitoring of Cardiac Dysfunction in Survivors of Adult Cancers. Survival rates for many types of cancers have continued to improve over the past several decades, contributing to a growing number of long-term cancer survivors. In fact, it's estimated that by the year 2022, there will be approximately 18 million cancer survivors living in the United States. With longer survival, attention to the chronic and long-term adverse treatment-related effects has become increasingly important. Cardiac dysfunction, presenting during or after completion of cancer treatment, is a well-recognized complication of cancer-directed therapy. The onset of either asymptomatic or symptomatic disease may also be responsible for interruption or discontinuation of cancer-directed therapy, potentially reducing the chance for long-term survival. In children, those 21 or younger at cancer diagnosis, there are well-established evidence-based guidelines to direct surveillance and prevention of cardiac dysfunction. The need for comparable screening guidelines in survivors of adult-onset cancers was paramount, so that proper interventions can be implemented to avert the risk of cardiac dysfunction during and following completion of therapy. The ASCO Survivorship Guidelines Advisory Group recognized this guideline topic as a high priority for development, bringing together a multidisciplinary team to develop an evidence-based guideline which could help healthcare providers and patients alike. I was honored to co-lead this effort, and we utilized well-established standardized methodology to craft the guideline recommendations. Importantly, this guideline is the only one of its kind to have been endorsed by both an oncology and a cardiology organization, having undergone an extensive review by both ASCO and the American Heart Association. This guideline provides clear recommendations for monitoring and surveillance of patients at risk for cardiac dysfunction due to treatment-related exposures such as anthracycline chemotherapy, certain targeted therapies such as Herceptin, and radiation therapy, as well as cardiovascular risk factors present during or after completion of cancer-directed therapy. The intensity of surveillance is largely dependent on the level of risk, as defined through careful review of the existing literature. Key guidelines recommendation include: clinicians should avoid or minimize the use of potentially heart-damaging or cardiotoxic therapies if established alternatives exist. Prior to starting cardiotoxic therapy, clinicians should perform a comprehensive assessment, which includes medical history, physical examination, and screening for cardiovascular disease risk factors. Providers should discuss the potential for heart problems with patients who are at increased risk for such complications prior to the start of therapy. In patients who have an increased risk of developing heart problems, a tailored and detailed plan to monitor the patient throughout the cancer treatment and beyond should be established as outlined in the guideline. Of note, patients considered to be at risk for cardiac dysfunction include individuals treated with high-dose anthracycline, defined as a lifetime cumulative dose of 250 mg per meter squared of doxorubicin or greater, or 600 mg per meter squared of epirubicin or greater. Individuals treated with high-dose radiotherapy, defined as greater than 30 gray, where heart is in the treatment field. Those treated with lower-dose anthracyclines, in combination with radiotherapy, where the heart is in the treatment field. Individuals treated with low-dose anthracycline or trastuzumab alone, but who also have the following risk factors: multiple cardiovascular risk factors such as smoking, hypertension, diabetes, dyslipidemia, and obesity, older age at cancer treatment, compromised cardiac function such as borderline low left ventricular ejection fraction, history of myocardial infarction, or moderate to severe valvular disease at any time prior to or during treatment. Additional recommendations regarding primary prevention and long-term screening for cardiac dysfunction are detailed in the guidelines. As part of the guideline development process, we identified important gaps in knowledge pertaining to the cost-effectiveness of early screening, timing and type of intervention in asymptomatic patients, as well as optimal population-based strategies in long-term cancer survivors. Clearly, studies are needed to examine the cardiovascular pathogenic mechanisms associated with cancer treatment, as well as prevention of short and long-term cardiovascular complications. Ongoing collaboration between the oncology and cardiology communities is integral towards the development of such studies. Thank you for listening to this week's episode of the ASCO University Weekly Podcast. For more information, be sure to check out ASCO University's quarterly e-learning series on ASCO Guidelines, coming in 2017, by visiting university.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.